You and I with Rashmi Shetty is a simple attempt of bringing in stories of people you and I can draw inspiration from. Ordinary folks, extraordinary lives. Their uniqueness and individuality that make them interesting to talk to and to listen to. A reaffirmation of the fact, open your eyes wider. The world is far more beautiful when we acknowledge the presence of both you and I.
On the website of the World Health Organization, an article dated 28 September 2020 speaks about adolescent mental health. Some astounding key facts are 1 in 6 people are aged 10 to 19 years. Mental health conditions account for 16% of the global burden of disease and injury in people aged 10 to 19 years. Half of all mental health conditions start by 14 years of age, but most cases are undetected and untreated. Globally, depression is one of the leading causes of illness and disability amongst adolescents. Suicide is the third leading cause of death in 15 to 19-year-olds. The consequences of not addressing adolescent mental health conditions extend to adulthood, impairing both physical and mental health and limiting opportunities to lead fulfilling lives as adults. This got me thinking, and therefore, the next 2 episodes of You and I with Rashmi Shetty is dedicated to mental health. We just celebrated World Health Day, and this time the focus was on mental health. We have with us Dr. Kaushik Roy, who specializes in child and adolescent psychiatry and sees patients from the age group of 5 to 25. He is associated with St. Luke's University Hospital in Pennsylvania and teaches fellow residents, medical students, and mentors psychotherapists and advanced practitioners. He also collaborates with other disciplines of medicine. Part 1 of the 2-part series on child and adolescent mental health. Hi, Kaushik.
Pleasure having you here on this podcast in this episode. I want you to take a couple of steps back to go back to the time when you completed your MBBS. Was psychiatry an area of specialization that you were very clear you're going to get into, or were you aware of mental health problems like people are talking about it today? What is it that seeped you completely into psychiatry as a specialization?
So first of all, Rashmi, thank you so much for having me for this. So the question you asked is a very important question. When we were doing our medical school, at that time itself, yes, mental health was there. Psychiatry has been there. But in the last centuries, I guess the way people perceive mental health and the way in the 20th century people are accepting mental health, there has been a big shift. Have we reached the place where we would like to be? Maybe not, but we have come a long way. So for me, while doing med school, I did not think that I was going to get into psychiatry or mental health as such at that point of time. It just happened. So it's like this, like so many of us always, we decide that we want to take this path to move on and thinking that this is the right way. And somewhere down the line, you come across things and you start saying that, is this really what I want to do? Or I like this more and I want to pursue that more. And that's how something happened with psychiatry. Being a family with a lot of physicians and doctors and nobody involved in psychiatry, that was not the first thing I thought of. After moving to US, while I was still waiting to join residency or trying to pursue medicine, I started looking into it even more. And I realized that whilst, of course, while I was working with patients, that mental health had such an important part in our physical health. And it's like so funny that we always talk about certain physical illness so openly, but with mental health, it's not the same. Like, people don't say, like, I have cancer or I am cancer, but people say I'm depressed or I'm anxious. There's a two different way of saying it. And I realized that while working with patients, not from mental health, but working with patients from other disciplines, and also some family experiences in back home have drawn me towards mental health. And I felt that I'm very suitable for this, and I could not imagine myself doing something else. And I started to look more into that, and which led me into getting more trained, getting more exposures, eventually residency, fellowship, and here I am working with children and adolescents, a decent chunk of it with autism spectrum, apart from what we see in children and adolescent mental health, including depression, anxiety, ADHD, trauma, psychosis, and a lot of genetic syndromes who also have comorbid psychiatric issues.
While you were studying psychiatry, were there some specific aha moments? With psychiatry, like you said, in mental health, you don't have tangible results where people can measure against a scale. It's something which is internal. So it's difficult for the patient to understand that he or she is slowly moving. In a physical ailment, you can see the progress. That suddenly you wonder, when will people understand? Why can't they understand it's not as simple as they're making it out to be? What were your aha moments to tell you that, yes, this is where I think I'll really find what I want to do, make a difference?
There were so many, Rashmi, over the course of my path in psychiatry or in journey in psychiatry. But one of the biggest one, what I felt is the hope. The word of hope which you give it to them, that, it is going to be better, or at least I'm listening to you and this is something we could do it together. So giving that hope, which made me think that I want to move forward with it. For example, like, just imagine that a family coming in and they don't know what's going on with this 17-year-old son or 18-year-old son who's actually having a first break of psychosis, unfortunately, and there is no history that they are aware of in the family. And he's just a normal functioning kid who was doing so well in the school, and his life was just as it is, and they just don't know why there is a certain deterioration in his life, in his personal life, in his academic life. And they are just devastated with his going down the line. And when you kind of explain to them that it's not easy, but what the person is experiencing could be a lot. We have to figure it out, but it could be a journey which he's starting, or it could be something that some related to something stress which has happened. He might be experiencing what he's experiencing right now. And sometimes it could go either way. What I mean either way is that sometimes it could be just related to depression, or sometimes it could be something more severe, which we sometimes come across, which is called schizophrenia or something, and their prognosis could be worse. In both the cases, when you have that hope given to the families and they feel that, okay, there is some way, depending on what they are struggling with, that there is some silver lining, and seeing that from the family and giving them that hope satisfied from time to time. Also, another example I'll give, that when I was doing my training, I also saw among family members that all they had to wait for my phone calls and talking to them. And all I did from 1,000 miles away, just talking to them and just listening to them while they were struggling with their own physical illness, and how it helped to elevate themselves while struggling with their physical illness. I don't want to go into the detail of the physical illness the family member had, but that is the time I felt that they were waiting for me once a week just to talk to me. And that helped them so much. And that's the time I realized that I want to do this because I think I can help more, because I have that ability to help. And I want to learn more. I want to train myself more if I could do that.
You spoke about so many different conditions, Kaushik. You spoke about psychosis. You spoke about many other conditions that you're dealing with. But when you're talking about children, okay, adults can tell you, there are people who, when they're going through depression, say we feel a hollowness in our stomach. We feel nothing moving. We are on autopilot. We are just working and we know we are not too happy, too sad. We just cry for no reason. These are some of the typical symptoms, is what adults say. How do children as young as 5, 6 express what they're going through, that the parent realizes that the child is going through something which needs a medical intervention?
So for children and adolescents, again, the cultural aspect come to it, their education level of the family comes to it, their awareness of mental health, all those come into places. As you said, Rashmi, and I think we spoke before also, that for children to express themselves when they're struggling in mental health is not the same. They do not understand what is depression. They do not understand what is, anxiety. They do not understand what is the psychosocial stressors, means that what's going on in their social life or family life and how they react to it. So when you're struggling something within, for example, let's say children every day before going to school, going on saying that I don't want to go to school, I have a stomach ache. I don't want to school because I have, some issues in the school with somebody, or somebody in the school have mentioned something to me. So the family goes on saying that he's a 6 or 7-year-old. What are they saying? A lot of the time, because of lack of awareness, family just wants them to move on, and it becomes more and more over the time, which just could be anxiety. The anxiety could be from what they were facing in the school. It could be a lot of different things. Is the anxiety coming from because they are not able to pay attention in the school? Is the anxiety because someone in the school has not been appropriate with him or her? Is something is happening while they are in different school setting during the break, lunch break, somebody has been bothering them or kind of bullying them? All those things could happen. But for family, when it comes across, it's just that this kid is giving such a hard time for going to school, but I have these other 2 children I raised, they never bothered. What is going on? He's just being very difficult. So that can happen, and it is not the fault of either of them. It is just the lack of awareness. Sometimes it could happen, and lack of understanding what's going on, because children will not say they are anxious. They will not say they are depressed. They just come out saying all these different somatic complaints sometimes, or vague, most of the time very vague. So kind of driving deep into that, it kind of helps us that which direction we need to go.
Kaushik, April 2nd was World Autism Awareness Day. Since we're talking about mental health and mental health awareness, is there anything, I know the topic is a wide topic by itself, we can speak hours on this topic, but since we are anyway there, can you give us
some indications that parents can pick up from the way children behave to understand if they are in the spectrum or not?
Sure, Rashmi. This is such an important topic. I don't know whether it is the awareness or the availability of the way things have been over the last 2 decades or so that we see more and more people being diagnosed with autism. Even in our practice, we see a lot of children and adolescents have come across that they want to know if their child has autism or not. And a couple of things we start with basically saying that what all has been done before or what has been happening, so to get a timeline to see what things are. Because you have to remember one thing, some children will show signs of autism in early infancy itself, like, they could have reduced eye contact, lack of response to their name or difference to caregivers. Some children will see that, they develop normally for the first few months or years of life, then suddenly they become withdrawn or aggressive or lose language skills. So some signs usually are seen by the age of 2 years itself. So the earlier the intervention, the better they could manage when they are progressing in their life. So as you asked, what are the signs or warning signs that parents could look into their children or adolescents in case they have any concerns? The most important ones are that the social communication and interaction, and the other part is that patterns of behavior, which we would say as stereotypal behavior. To the first point, what we spoke about is the social communication and interaction. So you could see that if they're failing to respond to their names or appears they're not able to hear you at times, one thing, they resist cuddling or holding, seems to prefer to playing alone, sometimes oblivious to the world. The other part is that they have very poor eye contact and lacks facial expression, delayed speech or doesn't speak or doesn't have the ability to say words or sentence which they had before or was making or mumbling. They cannot start a conversation or keep on going, or only starts but doesn't make sense or make requests or label certain items. Sometimes they are able to speak in an abnormal tone or rhythm, or maybe using a sing-song voice or robot-like speech. They could repeat words, phrases, verbatim, but doesn't understand how to use them. Sometimes they not understand the simple questions, doesn't express emotions or feelings, also appears unaware of others' feelings, as though they're not getting the social cues, like, when mom, dad, or friends or somebody, if they're angry or they're upset, they're not with the situation how they were behaving at that time, and it comes across as odd, and it doesn't appear as at the level of their developmental age. It seems like they should, or our other children could find that they could relate to it, but he or she cannot. They doesn't usually point at or bring objects to you that they have some shared interest or something like that. Inappropriately approaches a social interaction by being passive or aggressive or disruptive. Okay, so those are the things you would see in interaction. Another important one is that the non-verbal cues. So they fail to recognize the non-verbal cues, interpreting the other people's facial expression, body postures, or tone of voice. So this part is a part of the communications or the interaction. The other part, the patterns of behavior. So you will see that they have some repetitive movements, like they might be rocking, spinning, or they may have flipping of their hand, which we call as steaming. So you would see them, which kind of stands out. Sometimes you will see that they will involve in activities which could harm themselves, like they may bite themselves when they're upset, or they'll bang their head, slap their head, and you don't know what happened. Sometimes it does any trigger itself, sometimes there could be something, but they get into those kind of behavior. Then they could have specific routines or rituals, and they become so upset with the slightest change, so that you could see easily that they do not like changes on simple things, even in the household. Sometimes you'll find that they have difficulty with coordinations or odd movement patterns because they will be clumsy, or they'll be walking on the toes, or has odd or different kind of body languages. Sometimes you'll see that they're fascinated with details of such an object, like, a toy car or certain color or certain, movement of certain things, that they just get overly fascinated or get stuck with that. Okay. And they don't even understand the overall purpose of that, why they're doing it, or is the function of that object, but they're just stuck, or they're just overly interested in that thing, that it is unusual. Sometimes they could be sensitive to sensory issues, like sensitive to light, touch, sound, whether high pitch sounds or low pitch sounds. And sometimes you'll see that they're indifferent to pain or temperature. They don't realize it. Another important one is that they do not engage in imitative or make-believe play or pretend play. You will see that usually other children could, but your child is not able to do that. Sometimes they could fixate on an object or activity of the abnormal intensity or focus. They could have some issues with textures. Again, it is sensory issues, like food preferences, only eating a few foods, or wearing certain type of clothes, or prefers to wear certain clothes, are very, very rigid when changing in clothes, because they only would like to wear only those type of clothes. But you'll see people even with autism, as they mature, some children could become somewhat more engaged with others and will show some fewer disturbances they have shown before.
Okay, Kaushik, these are certain indicators for sure. But, being fascinated with the color, fascinated with the toy is pretty normal for children when they see something new. How does a parent know that this is an indication of a problem, and therefore what can they do when they see a child will the child be extra fascinated with that toy and would not like to give away the toy? What is it the parent should do to find out if the child is in the spectrum of autism, or is it just a normal fascination in life?
Very good question there, Rashmi. So what we need to see is that whether it is a normal behavior, is a normal, that extra interest that person have, or it is something more. So as I mentioned before, that it is beyond their developmental age, that, that they are showing so much more interest or getting stuck to it so much more. That becomes concerning. So what I always tell parents, that if you have a gut feeling, don't hold back. Address that. Talk to your primary care doctor or your family doctor and say that, what, these are the list of things we have seen, and maybe it's normal, but we find it somewhat it's odd. So what's going on? So what happens? You have to remember one thing, and people, as I said, they have become more aware that what is autism, and sometimes they think what's going on, where is it coming from? So over the last few years, which has become also more prevalent, or people started talking about it. People earlier thought that autism is related with vaccination, but a lot of research and studies have shown that there is no connection at this point of time. There is environmental factor and genetic causes which could cause both of them. So for the environmental factor, as you can say, that there are a couple of them, that the male or boys have more chances. Parents' age makes a difference. If there is a family history, there could be even more chances of having autism. So I don't want to go on details because we could go on talking about it, but definitely those are the things to look for, right? So the next question comes, so even after this, what the parents do? So autism could be diagnosed by your primary care doctor referring to a neurologist, or a child and adolescent psychiatrist, or a developmental pediatricians, or a developmental psychologist. They could do it, so where they would have a battery of tests they would do to kind of tell that yes, this is probably they are in the spectrum and we need some extra help. So as I said, that intervention earlier that is, the better the outcome will be. So remember one thing, when a child is in the spectrum, it doesn't mean that the autism is going to go away. You could take intervention so that they could have a better quality of life. They could become more independent in the long run. So those are the intervention needs to take place. Depending on where you are, whichever part of the world you are, They would have different intervention based on their funding, what they have, what the resources they have. So is there any medication? Sometimes they say that, that could help. Yes, there are medication, but they could only help managing the symptoms. It is not going to take it away. So there has been a lot of research done, but applied behavior analysis therapy, that could really help them, along with other interventions. Like, that's why the analysis by the psychotherapist, or, as I said, the developmental psychologist is important, because you want to see what is their cognitive abilities. Based on that, they could start implying or implementing different kind of resources that what they need. So if, first of all, it starts with whether seeing that, there's audiology evaluation to see if the hearing is okay, if the speech is okay, is there any developmental delays? Because you also have to remember, sometimes autism could be also comorbid with developmental delays. So is there any developmental delay? What is going on in that, whether they need any extra help? So that also helps with the autism itself. So there is speech therapy, there is occupational therapy, there is physical therapy. Those could be helpful. So these are the few things to start with. That's all I can say at this point of time.
Thank you, Kaushik. That was really a very good input. I know it's a wide topic. And talking about awareness, there is another question that, with the current situation and scenario with the youngsters as well, children and adolescents, many of them are diagnosed with depression, and many tend to try and commit suicide or end up being successful. So can you throw some light on that?
Wow, another important topic. So yes, there is definitely a link between having depression and suicidal thought or suicidal behavior. But also we need to know self-harm behavior also. So there is something called non-suicidal self-harm injury, right? So first of all, we need to know what is the function of self-harm, which is perceived by the person who is engaging in the act. Number one, maybe it is just to obtain a relief or release from the burden of their intense feeling which they have, because they feel that in this way they could feel something different. Sometimes they describe it as an act of allowing them to experience a rush of positive feelings, similar to an addiction, or simply to feel alive. Another thing is that they feel that they want some kind of control or to cope with different or difficult feelings. Like, for example, that adolescent explains the acts of self-harm, it helps them. Sometimes it could be even associated with traumatic events. So by this, they get a sense of control when they are feeling alienated or helpless, and it could feel numb or neutral. The third one is that it sometimes connects with others. For some adolescent, it helps them to connect with a group of people who share similar problems and feel like outsiders. So they just want to be connected with them. And also is used to express the pain to others and ask for help. The self-harm behavior, the other one, the last one, I would say that it could be to present the unaccepted feelings. Sometimes they feel they are at loss. They don't know how to express the right words to their feelings or assert themselves. So they express a desire to protect the friends and family from their feeling, and from finding out that they were engaging in this behavior. So these are the ways they do it. Now, as you know, there's studies done, researches has been done. I think among the high schoolers in 2018, there was a study here, and they said that almost 18% of the high school students in US engaged in self-harming behavior in that year itself. And out of that, almost 30% of them were girls, and almost around 11% were boys. So what you could do to help them, couple of things we could do when the children and adolescents, they are getting involved with this self-harming behavior. One is that improving the communication, engage them to talk to you about their issues, or it could be even an online help, or even a therapist, or any other support or online resources available, especially nowadays. If you are a parent, do not ignore, as I said before, even for the autism, do not ignore your gut. You say to your child that I'm worried about you. tell me if there's something going on, or is there something that you need to share. Do not ask why, because the moment you ask them why, they may become defensive. So might as well you can say that, I hear you, but how do you feel about it? So let's talk about that. You could provide distraction, like say that, help them to replace their self-harming behavior to something positive or physical behavior, like going for a brisk run, or when they have the urge, ask them to maybe take a shower or wash their face or do something like that. Tell them, what, do a breathing practice. Let's do it together. Let's find a place in the house or somewhere where no one else is there and monitor your breathing and counting maybe for a few minutes, and you will see the results in a few minutes itself. Sometimes you could just stop whatever you are doing, take a deep breath, and try to observe what it is to feel like to take that deep breath, and then proceed what you are doing. You will see that sometimes it helps too. The last but not the least, get help. You could reach out to, as I mentioned, that to the nearest emergency room or something when you find that it is overwhelming, that you cannot help yourself and you just have this urge to hurt yourself, so which is beyond that self-harm of just cutting, just burning, just punching. You are thinking like you want to kill yourself and you are not feeling safe. So just go to the emergency room or to the doctor's office, and while you are there, sometimes maybe waiting for like half an hour, an hour, and if you feel your urge is going down, okay, then you can see that, okay, whether you want to still see the person, the doctor is fine. But if you feel while you're waiting to be seen by the doctor or the professional and it continues to escalate, please seek help. That, you're feeling suicidal. It's no more the suicidal, self-injurious behavior, but it is converting or it is escalating to the point that you may end up doing something. So they may need to admit you or observe you for some time. They could do that. If you don't want to do any of this, call up the phone numbers in the, in your area because nowadays there are so many online help available. Do that.
Certain indicative phrases or sentences that the children give as indicators that parents should pick up, which is not normal language. Do the children express that I'm fed up with life, I don't see a point in living, sometimes I just feel like not living anymore? Do they give such direct clues for a parent to pick up, or is it only non-verbal that parents pick from behavior that parents should be noticing?
So it's a mix of both, because sometimes parents who are aware, they take it seriously by any of those, because let's say a child or an adolescent have never mentioned a line like that and they come up with that. If parents are aware, they take it seriously. Again, because of the stigma or taboo, they're like, you're just overthinking. Where did you hear that from? Did you hear that line from somewhere else, or or in your TV or something? We didn't feel like that. Why did you say that? So they can brush it off. But when somebody is saying something like that, I would say the parents should take it seriously and find out, as I said, instead of asking why, saying that, I hear you, and, let's see that why you're feeling that way, and kind of see that where they are from. Because if they really have been feeling that way and they were holding back and they're asking, that means they are asking for help. They don't know how to, but coming to you or making those, comments from the side, you should pick it up and at least try to give some importance to it, until you feel that, no, it was just a attention-seeking behavior or just to have get attention from the parents for some reason. As long as you're comfortable with that, that's fine. But do not let go. Do not let go with anything it comes in those directions. Because, as I said, there are so many things out there nowadays because of social media, and they may be looking into that before even coming to you. So if you are not educated enough about it, and if they are giving some clue, there is no harm exploring it more before just dismissing it.
I have a very simple question for you to answer maybe, but it's a question that I've been having for quite some time. Stress and depression. Does stress lead to depression or depression lead to stress? Because for a small child, you don't know what the child is going through. So is there any connection between the two?
Stress could cause depression. Does depression cause stress? Still, there is some doubt in that, but again, some amount of stress is good because it could motivate you. For example, like say when a work deadline or you are in a competitive sport, that would motivate or mobilize your body to respond, improve your performance. But if it is a chronic stress for too much, it could lead to depression in people who are susceptible. For example, positive event such as even getting married, beginning a new job, or relocating, all these things could cause stress, but does not necessarily mean that will lead to depression. Yet, about 10% of people suffer from depression without the trigger of a stressful event. So the stress and depression connection is there in a lot of ways. Now again, this is connected to brain. So when you are stressed, a portion of the brain, which is called amygdala, it gets stimulation, and then it sends some signal to hypothalamus. Hypothalamus, another part which releases called corticotropin releasing hormone, that goes and affect the pituitary, and pituitary releases something called ACTH, which affects the adrenal and which releases the cortical or stress hormone. And that stress hormone could affect our normal biological process, like our sleep, appetite, energy, mood, and emotions. There are also other stress hormones like epinephrine or adrenaline and norepinephrine. So let's say when you're stressed and you are breathing harder, and the way your body responds, that your blood is rushing from places where it doesn't need that much just to cover up. So that could changes your blood pressure, that could changes your blood sugar level, and over the time it could definitely have an impact. It also suppresses your immune response. So what will happen in the long run, you are more susceptible to sickness or getting into a lot of other diseases over a long run. So stress is definitely impacts your physical health, and it could lead to depression when it is chronic over a period of time.
It comes to communication as the child grows older, in the teenage or preteen, children stop communicating more at home and prefer talking more to their peers rather than parents. Now, coming back from school, throwing your bag and getting into the room, closing the door and doing whatever behind the door is something where children ask for privacy. Now, how does a parent enter the child's world in this phase of confusion for the child also? Because peers start influencing an individual a lot more than parents do. Parents seem more preachy while peers seem cool. But what if the child is in that phase where he or she doesn't like to communicate anymore with the family but prefers being left alone in the room with friends online or offline? How do parents pick anything from such spaces? And how does will communication ever be bridged there? What is the kind of bridge we should build?
It's difficult in certain ways. What you need to see that, let's say this is the same son or daughter used to behave in a different way. It means they were more interactive, more social, in a normal way. Okay, whether they were a teenager or even before they turned into a teenager. But right now, they are withdrawing itself a little more, or more to the point that you start to worry about things. But you also notice that they are okay with their peers. You have to know it for sure that they have enough friends, and there is enough indication that they it is not that they're not isolating themselves from everybody. How to get in touch with their reality or their world? Again, there is no specific way of doing it. I guess it depends on the cultural background, socioeconomic background, the parents, their awareness of things, because sometimes people are overly concerned also, and they want that privacy.
In fact, there are some parents who are over the top when it comes to children and their reactions. And sometimes it is parents who actually do not care much and say, okay, this kid is just asking for attention. Just go to school. That's it. Okay. So where does the parent draw the line to understand that it is way deeper than the surface? Because it can't be the first time or the second time the child says, I don't want to go to school. I've got a stomach ache. I don't like this teacher. I don't want to go to school. When does the parent get the indication that it is deeper than what the child is saying? And it is more important for the parent now to listen.
So again, there are so many folds in there itself, right? For the parents to know when it will happen. As the children cannot immediately pinpoint what's going on with them, it's just like a pattern emerges. When the pattern emerges and it goes on for some time, and which starts to affect their functioning. So for a children of a couple of years old, their functioning level is that how they're doing at home, as a child, as a son or as a daughter or as a grandkid, how they're doing with their peers or cousins or neighbors, or in the school, how they're doing in terms of their grades. So when they see in a few weeks or few months that it is progressively declining from the level they were before, then they start to think, and then they start to think something is going on. Or that's the time I would say the parents should start seeking help, that he or she is not the kid I knew 6 months ago or 3 months ago. Something is going on and we need to talk to somebody. It might not be easy because sometimes they don't know whether they should go and talk to the pediatrician. In most of the part of the world, because of the awareness of the mental health, though it has improved but not as much, they would probably at least go to the family doctor, and that should be the start, whether they need to have any kind of intervention or not. But overall, whenever there is a functioning difference in the child's regular as part of their age, if there is a change, you should. I did not say everything, even including sleep, how the person is sleeping, or how is he or she is doing at home in their regular setting, which was never a problem before, but over the last few months it has become a problem. So that's the time we need to intervene and get help, saying that what's going on. Is there something organic or is it something psychological? We need to kind of figure out.
How do you handle parents, Kaushik? Do you get into a counseling mode with them in the pressure of being the best and wanting their the kids to be the best wherever they go? There is a lot parents go through as well. With the cases that you see, how much of parental pressure makes this entire experience of parenting that much more stressful for the child?
In the practice, of course, what happens that, as I mentioned before, so when you see children and adolescents coming in, and in today's days and world, that when the social media has come and social bullying, social peers, the pressure from social media, it also takes the situation multiple fold for parents, for children. It's not an easy job to be parents nowadays compared to before. And in a competitive world, a lot of the time it goes with educating parents. Because as you mentioned, right, the parents, they always want the children to achieve which they never achieved. Some of the parents do, and that puts a lot of pressure on the children, in terms of their academic challenges. They want them to do well. All of them want them to be the topper in the class, want them to do the best, which is okay. But you also have to see what's their capability, what they like or what they want to do. I know that people have become more aware and they are coming off that stereotypal thing with professions and things like that, but there is still a lot more to be done. So a significant portion goes with parent management training. So definitely we spend time on that, asking parents that, if you feel that you guys are struggling in terms of understanding your child, or he's so rebellious, he's so oppositional that you can't just get to them. And otherwise, I tell them that the parent-child interaction is a very important. If it is not possible the way things are at home, I also mentioned that some family therapy or family work is very important, so that there is some cohesion, definitely. And PMT or parent management training, which also could help them to address those issues at home, where the parents find that they have good intention, the child have their good intention, but they are not able to find a common ground. So getting some help will be definitely advisable at this point of time. And how do you get those help? As I said, online resources, if you have, reading some books, online books there are there, how to manage or learn in today's days and time to have a better communication with your child, or children are having better communication with the parents to be in the same wavelength. So those are the things I definitely suggest parents, and which is also a very important part of their mental and physical well-being, to have a good interaction with family. Hope this was helpful.
It definitely was. Very powerful words, Kaushik. But as a psychiatrist yourself, you are seeing a mixed bag of both positive and negative. Self-healing is equally important. What do you do to motivate yourself, Kaushik, in order to be upbeat all the time?
So my motivation is that all these families are waiting to get some help. They are waiting for months together to a visit from the psychiatrist. And when I see them, as I mentioned before, that the hope that I can give by just listening to them, that there is silver lining. There is hope that you will do better. There are ways to manage it better. Am I taking it, or am I fixing everything? No, I'm not saying that. But I am going to help you to talk about things so that you could manage it better. That motivates me from every day. In the last year or so, I don't think so that I missed a single day of work, because I knew that they're waiting through their Zoom meeting to talk to me and to find out how do they manage. And when I saw the families over the pandemic itself, that so many of them have improved, it just drove me to do more and more. That I'm not only helping the child, I'm helping the whole family. And that's how it happens in mental health. When you are struggling with physical health, the person suffers the most. Of course, with mental health too. But when your child suffers, the whole family suffers. And that is a huge impact. So when I see that I'm helping the whole family, the parents, not only the child, and so many families have been helped, it just wants me to move on with that on a daily basis. There were times that you're exhausted after the day's work, but you're returning the phone calls of the patients. I spend hours every day returning phone calls because, again, access, it's so difficult. So what happens that when in the beginning, when you are seeing a patient, they have a lot of questions because they are also trying to understand what's going on when it comes to medication, how the medication is going to work. There is so much education is needed because sometimes some of it doesn't work immediately. And a lot of the time, parents does not understand, if they don't themselves have struggled with mental illness, that, it's not like taking a painkiller or a paracetamol. You have a headache, you take it, and your anxiety or your depression is going to go away. Most of the medications, when it comes to situation like depression and anxiety, what you use, which we call an SSRI group of drugs or SNRI group of drugs, which are the first line of drugs, it takes up to 4 to 6 weeks. And not every medication works for everybody. They experience different things with each of them. But they want to know whether it is helping their children or not, and they would want to reach out. So just imagine that they're waiting for a phone call from you just to know that whether it is okay what the person is experiencing and they could continue or not, or they need to stop it, or they need to look or think about an alternative. And that is something that you are doing. I feel responsible for all these families, that if I could help them in any way, that will be my gain. At least a bit of it. I'm not going to change their life, but I will help them so that they could adapt better with what they're going through at this point of time.
Positive, absolutely passionate, a very beautiful combination to be in a profession where it's all about giving. So I think the universe has its plan in place of putting you in this space where you can make a difference to so many people, Kaushik. Happy for you.
With that, we come to the end of part 1 of this 2-part series on child and adolescent mental health with Dr. Kaushik Roy on You and I with Rashmi Shetty. Do let us know if you know people who make the world beautiful. Write in to rashmi.thirdeye@gmail.com. That is rashmi.thirddeye@gmail.com. Come, let's explore this amazing world together, both you and I.